how to prevent knee arthritis with these simple steps. I'm going to tell you today exactly how to make sure that you never end up with knee arthritis, which can impact your exercising, getting up and down the stairs, ability to play with kids and grandkids long term, and ensure those knees stay healthy, active, and free from painkillers. I'm Dr. Jeremy Andrews. I'm a doctor of chiropractic here at West Chiropractic in Surrey. And I'm looking forward to going through these steps with you today. So what is knee pain? Well, knee pain is a very common thing that we see here as chiropractors. It's pain that can be in the joint, around the joint, above and below. It can be characterized as a low level dull ache, or it often could be a sharp shooting pain on movements, particularly twisting, that's causing problems. Today, we'll probably talk about more of the low level dull ache pain that is caused by arthritis, or pre-arthritis as we say. Arthritis just doesn't happen overnight. It can take a bit of time to get there. So very often arthritis can be caused by a knock or a bump from an early age. For example, a sporting injury like playing football. Someone tackles you from the side, causes the knee to swell up, inflammation, there's pain at the time, and then over 2 to 3 weeks the body does an amazing job of healing the knee, but it's not necessarily kept in alignment, and then the body can then put pressure on one side more than the other, and that causes a misalignment through the knee and causes degeneration through there. Inside the knee you have an amazing network of tissue, cartilage and ligaments. So everyone knows about the cruciate ligaments that holds the tibia to the femur. Femur being the hip bone, the tibia being the front of the shin bone. The cruciate ligaments prevent it from going backwards and forwards. That's an ACL. ACL is anterior cruciate ligament. That's a very common football injury, netball, basketball, where the knees pivots and it causes a tear in the cruciate ligament injury. Also skiing as well. Skiing is not good for your ACL. What we're talking more about today though is the meniscus. So those are the pads that sit on the knee, the two discs in between, and also the space between the meniscus. It can stick up and it can cause problems when the knee is then catching. That can be quite sharp. But gradually over time, if that meniscus starts to wear away, that's going to cause a low level dull ache in the knee and cause the bone to start to change shape, the gap to get close together. Those are the two features that are very common in arthritis, particularly osteoarthritis. So how do we get the knee in the best shape to prevent arthritis from ever coming in? Now, you may not have had a trauma in the past and you just want to make sure that your knees stay healthy long term. You may also have seen some friends or family members that have suffered with debilitating knee pain and they've had a knee replacement, but you just don't want to go down that route. Just for context, knee replacement surgery is very successful, but it is surgery at the end of the day. It's always risky when going under the knife, and if you can avoid that, then why would we not? I think we prefer that, the surgeons would prefer that, everyone will be much happier. So we're going to talk about the exact steps that we use with our clients every single day to keep their knees as healthy as possible. Number one, this is for all the ladies out there, and maybe the guys, avoid wearing high heels. The reason I advocate avoiding wearing high heels is because of the force that it puts through the knee. The foot will push up like this, which then causes the weight of the body to translate forwards and it loads down on the front of the knee. More load on the knee is causing that space to get smaller and then can cause arthritis long term. Now, anything that makes you sore after an hour of wearing it is probably not going to be the best thing to wear. I know that if I'm wearing something like a waistcoat or a suit jacket, it's tight, it's restricting, you can wear that for a bit and it doesn't really matter too much. It's not causing you pain. But every time we go to a fancy do, like a wedding, and everyone's dressed up, it gets into the evening and I always see all the ladies taking their high heels off, they're putting their flat shoes on. Why not just start the day in the flat shoes? Now, all the ladies will say, Jeremy, you just don't get it. You don't understand. I look so much nicer in high heels. I feel more confident. I think they're great. And it may be that. And don't get me wrong, I think ladies look lovely in high heels. It's great. But what is the detriment that it's causing to your body in the long run? Is it something that we could wear at the start and put some flat shoes on? I don't know. I'm just trying to give you my advice from a chiropractic perspective. The high heels, I would not wear them. Try and wear something flat or a much lower heel as well. 2, keeping moving. Using light exercise such as swimming, low-level walking, up and down hills in order to flush the knee joint, keep the fluid nourished through there. Swimming is a great way to get aerobic activity into the joints in your body, not just your knees, from a load-bearing perspective. We love swimming because it allows the body to move in different positions that it wouldn't necessarily do when you've got gravity there, and allows then the joints to get in positions that the ligaments can then adapt, they can expand, we can nourish the joint and keep it from that compression. So very often with running, it's impact, and it puts a lot of pressure through the knees. The swimming is lovely because it opens everything up, takes the pressure off the knees. So this is a Muncie knee raise. And this is great because it activates the inside of the leg here. I'm a big fan of this, especially for runners or people looking to get more stability in the knee. So I'm gonna hug the non-involved leg. So here is my left leg. And then what you're looking at here is, this is the involved leg. So straight here, you wanna turn the leg out to the side and you're gonna lift up like this. There we go. Now, you're gonna wanna watch this muscle here. This is called the VMO, and you're gonna pull up like this and then come back. Pull up like this and then come back. Now, if you can hold it up there, fantastic. But anything from 4 to 5 reps is perfect. So if you look at me now, I'm kind of like leaning back like that. You don't wanna do that. You wanna try and stay tall, leg out to the side, foot turned out, moving and holding like that. Okay, number 4. We're gonna use a band like this. You can get these on Amazon, they're pretty cheap. This is gonna activate my glutes through here. Lovely way to get more stability through that area. Taking a lot of pressure off my knees. So with this one, I'm gonna wrap it round just above my knees here. I'll probably double loop it. Green is pretty flexible. But if you've got slightly stronger legs, probably wanna get a little bit more into this, because your legs are pretty strong. So looping in like this. So if I start like this, you wanna get into a semi-squat. Bit of resistance on the bit of pushing out. Rotate the hips out. Semi-squat like this. And all I'm gonna do is keep my back upright. It's crab walks, crab walks, crab walks. And then back. You get some funny looks doing this, so I wouldn't do this in public. Like this. And let me show you from the side. So like this as well. Crab walks. Like this. Going back this way. Great. All right, it's gonna activate these muscles here. The glutes are big stabilizing muscles. They help the ITBs, those are the muscles down here. Take a lot of pressure off your knees as well. It's a really, really good way to stave off knee arthritis, making sure everything is strong around those areas. So number 5, you wanna make sure that you're using ice therapy, not heat. Heat is gonna exacerbate the inflammation. If you're getting the start of knee arthritis, they're gonna start getting a bit hot and boggy. You need to make sure reducing that inflammation by putting cold on there. So it's quite easy to do. Just get an ice pack, lay it over the front of the knee, pop it on there for 15 minutes, make sure it's wrapped in a towel. Do it when you're sitting at night, just making sure there's taking pressure off that area. And then you can put it back in the freezer for 45 minutes, then do again for 15 minutes. So if you're relaxing, reading, watching TV, probably get a few sessions of that in the evening as well, okay? Number 6 is all about the calves. So why the calves important? Well, the calves are really, really good at pumping blood back up to the heart. So if you can get the calves moving well, they're gonna help to nourish the knees, but also give you a lot of stability in the back of the leg as well, particularly when you're walking or pressing off like this. So I love doing a calf stretch. I'm gonna show you this on the wall here in a second, but it's a great way to get pressure off the back of the leg, help with the Achilles, help with your walking and mobility as well. Okay, so the first way is you're gonna stretch like this. So pushing against the wall, one leg goes forward. I'm stretching the left calf here, and I'm really pushing back into that leg. I'm also lifting my heel up a little bit and pushing into the front of the ankle, which is gonna help take some pressure off that lower leg. And I'm gonna swap over like this. Again, that's gonna be a great way to get a nice stretch through those calves. I would hold that for 30 seconds. So there we have it. Those are my top 6 steps that I use every single day with our clients here with any knee issues, or those that are wanting to make sure that they don't develop knee issues in the future. If you like the video, please like it, share it with your friends, and of course, as always, subscribe to the channel for updates. You can grab a copy of my best-selling book here, The Secret Cure to Back Pain, How to Avoid a Lifetime of Painkillers and Surgery. It's on Amazon down below in the link. Look forward to seeing you soon.